Hi, welcome to my podcast on ovarian cancer risks and how to reduce them. I'm Brooke Chavarria, and I'll be your host for this podcast. Ovarian cancer is not talked about a lot, so many people don't know they could be at risk for developing it. Here, we will talk about what those risks are and ways that we can reduce them. But first, let's talk a little bit about ovarian cancer statistics. According to the research done by the National Cancer Institute, about 1 in every 78 women will develop ovarian cancer. Now, the death rate among women with ovarian cancer has dropped over the past decade, but it's still high. In fact, the American Cancer Society estimates that in 2021, over 21,000 women will get diagnosed with ovarian cancer, and almost 14,000 will die from it. This is because the symptoms don't usually appear until later stages of the disease, so many women don't catch it in time. Annual exams and screenings are really important to get. They can increase the chances of finding the disease earlier, but they haven't proven to reduce the number of deaths. So the best way we can protect ourselves is to know our bodies, know our risks, and do what we can to reduce those risks. It's hard to believe that we might be in that percentage that will develop cancer, but it's very possible, so it's important to be proactive. Let me tell you about Linda, an ovarian cancer survivor who was one of the few to get diagnosed early on thanks to her persistence. About a year and a half before her diagnosis, Linda noticed changes in her body such as nausea, urinary and bowel-related changes, and a loss of appetite. Now, her doctor did a scan that showed a mass, but the blood tests were showing normal levels. And so he decided it was just irritable bowel syndrome, also known as IBS. Now, she's already dealing with IBS for years, and she could tell that this was different. But a few months passed, and she saw her gynecologist, who diagnosed her with a simple cyst. She told him about her symptoms, and she asked if it could be something more. They told her she was just being overly anxious, and it was nothing. So over the next year and a half, she had worsening symptoms that began to really affect her life. She had increasing fatigue, migraine headaches, and viral symptoms. Medical professionals would give her medications for the symptoms, but they would give her no reason for them. She soon had the added symptom of continuous pelvis pain. Now, a new doctor booked her for a scan and discovered the mass had doubled in size. Also, her levels in her blood had gone up. But after further scans, they again told her that they were just harmless cysts. But she insisted that she had every symptom of ovarian cancer and she needed more testing. So they did the further testing, and they did find out that she indeed had ovarian cancer. Now, if she had not continued to push toward the correct diagnosis, the disease would most likely have developed to stage 4 cancer or worse, which would have made her chances of survival minimal. Thankfully, Linda knew the symptoms to look for and was in tune with her body. She knew when things weren't normal, and she didn't give up when the doctors turned her away. So it pays off to be aware. So what are some of the risks? Some are in our control, but some are not. For instance, aging increases our risks, and we're all going to age whether we like it or not. Most ovarian cancer develops after menopause. Half of ovarian cancers happen in women ages 63 and older. Genetics are also responsible for up to 25% of the cases. Any family or personal history of ovarian, breast, or colorectal cancer also increases your risks. Peutz-Jeghers is a hereditary disorder that causes polyps in the stomach and intestines, and women with this disorder are at higher risk for ovarian cancer. No full-term pregnancies or pregnancies after 35 can contribute to the risks. Some of the risks that we do have some control over include using in vitro fertilization treatments or IVF, as well as taking estrogen after menopause. They actually make medication that you can take after menopause that is estrogen-free. Some other factors that could put you at higher risk for certain types of ovarian cancer are obesity and smoking. Now, there are some ways you can reduce the risk of developing ovarian cancer. These include having babies before age 26 and breastfeeding them if possible, the use of intrauterine devices or IUDs, or taking oral contraceptives. The longer you're on oral contraceptives, the lower your risk. Also, having your fallopian tubes tied or a full hysterectomy, including the ovaries, will lower your risk. A hysterectomy would lower it by about a third. So in conclusion, let's summarize. Learn your family health history, get regular woman exams and screenings, and do what you can to reduce the risks that you can control. Be vigilant about recognizing any changes in your body, especially if you have any of the risks we listed. Know your body, know your risks, and spread awareness. Thank you for listening to my podcast. To learn more or find local events, go to our website at sites.google.com/view/Ovarian Cancer Guild /podcast. Thank you.